In the golden sands of ancient Egypt, a civilization that built pyramids, mapped the stars, and embalmed their dead with surgical precision, there's one topic that rarely gets attention: toothaches. Not exactly the stuff of epic scrolls or hieroglyphic glory, but dig a little deeper, literally, and you shall find that the ancient Egyptians had some of the earliest and most surprisingly effective dental treatments in history, and some of them were absolutely brutal. To understand how Egyptians treated toothaches, we first need to understand the problem itself. Ancient Egyptian diets were full of coarse bread made from stone-ground grains. That meant sand, grit, and tiny bits of rock ended up in every bite. Over time, chewing this mixture wore down enamel and exposed the soft tissue inside the tooth, making toothaches not just common, but nearly inevitable. Add to that a high-sugar diet from dates and honey, and it's no wonder that many Egyptian mummies show signs of abscesses, cavities, jaw infections, and even tooth loss. But what's remarkable is not just the damage, it's how the Egyptians tried to fix it. Let's begin with their dentistry attempts, which were thousands of years ahead of their time. The Ebers Papyrus, one of the oldest medical texts known to man, contains over 700 remedies, some of which directly mention tooth pain. According to this text, the go-to treatment for a toothache often involved a mix of herbs, spices, and burned animal parts. For example, a common remedy included grinding up cumin, onion, incense, and frankincense, mixing it with beer or honey, and applying it to the tooth. Sometimes it was formed into a paste and packed into the cavity. The goal? To numb the area or suffocate the infection. Another method involved fumigation, lighting herbal powders on fire and directing the smoke into the patient's mouth. Think of it as ancient aromatherapy, but aimed at your gums. It didn't cure the infection, but it could reduce pain and even dry out exposed nerves. But let's not mistake these rituals for simple superstition. These weren't random guesses. They were early forms of pain management, antiseptics, and even antibiotic practices. Though Egyptians didn't yet know why they worked. Take willow bark, for example. It was sometimes used in mouth remedies, and today we know willow bark contains salicin, the same compound behind modern aspirin. They may not have had microscopes, but they had centuries of observation. Now, here's where it gets brutal. When the pain didn't stop, chafo and infection set in, the ancient Egyptian solution was a gentle dental cleaning. It was often extraction, tooth removal, without anesthetic, without steel tools, just brute force and a lot of pressure. Archaeological digs have revealed instruments made of copper and bronze that resemble early dental tools, tweezers, scrapers, even what look like forceps. While no direct written procedure for tooth extraction has survived, evidence suggests these tools were used to loosen and pull diseased teeth. Imagine sitting on a woven mat, clutching a piece of wood, while someone wrenches a decayed molar out of your mouth using heated copper tongs. That was the cost of relief. And here's the wild part. Some of those patients survived, healed, and lived for years afterward. Their jawbones refused. Their infections cleared. Not always, but often enough to suggest this wasn't a one-time fluke. It was part of a system, In elite cases, why it's thou they pu pro they a tu why way a they des ardadina. Human remains have been found with gold wire used to bind loose teeth in place, possibly the earliest form of prosthetic dentistry, not exactly Invisalign, but shockingly advanced for 3000 BCE. So, the Egyptians had plant-based analgesics, antibacterial fumigations, crude oral surgery, and even primitive prosthetics. But it wasn't painless, and it wasn't safe. In fact, many people died from dental infections. Skull evidence shows lesions that spread from the jaw into the sinuses, a sure sign that bacteria invaded the bloodstream, leading to death by sepsis. This is where brutal effectiveness comes in. When you had a throbbing, infected tooth in ancient Egypt, you had two options. 1, pray it goes away, or 2, let someone rip it out with a bronze hook. And often, extraction was the only way to survive. But it wasn't just physical. The Egyptians believed toothaches were sometimes caused by spiritual imbalance or even toothworms, invisible creatures burrowing in the tooth. This belief lasted well into the Middle Ages. So, treatments weren't purely mechanical. They were ritualistic. Spells, chants, and amulets were often used alongside the medicine. Healers recited prayers while applying salves, not just to treat the pain, but to cast out the cause. And here's the irony. That combination, science and spirituality, is what made Egyptian medicine so resilient. They didn't draw a hard line between body and soul. To them, health wasn't just mechanical, it was holistic. Today, when we feel a sharp ache in a tooth, we call a dentist. We sit in a reclining chair, listen to soft music, and receive numbing injections, digital x-rays, and sterile tools. But none of that would exist without centuries of trial and error, some of it brilliant, much of it terrifying, and much of it started in places like Thebes, Memphis, and Giza. So, what was Egypt's cure for a toothache? It was a bitter paste, a smoke ritual, a violent extraction, a bronze hook, and somehow it often worked. Brutal? Absolutely. Effective? More than you'd expect. And when your jaw was on fire in the 18th dynasty, it was the only relief you had. Because long before dentists wore gloves and masks, ancient Egyptians were already trying to pull pain out by the root.